Well, first, UK has taken a firm stand for children's health. It has announced a ban on junk food advertising. The government says this could influence eating habits long before they're formed. Under the new rules, advertisements for foods which are high in fat, sugar and salt will no longer be allowed on television before 9 p.m. More importantly, paid junk food advertising has also been completely banned online, where children now spend most of their screen time. So why did UK government feel the need to step in? According to the government, the evidence is clear. Children are highly influenced by advertising and repeated exposure to foods high in fat, sugar and salt. And this shapes their preferences and eating habits from a very young age. By limiting that exposure, the ban aims to reduce unhealthy food choices early on and tackle rising childhood obesity before it becomes a lifelong health issue. Now, the UK government says the ban is expected to cut 7.2 billion calories for children's diet annually and prevent 20,000 obesity cases every year. But this conversation doesn't stop with the UK, right? With childhood obesity and lifestyle diseases also rising in India, the question of how to protect children's health is becoming increasingly urgent here as well. India does not have a nationwide ban on junk food advertising, but the current approach relies on guidelines, on advisories, including food labeling rules, regulations around school meals, and also calls for responsible advertising. Much of the responsibility still rests on industry self-regulation and public awareness. So are these measures enough? To discuss this, to understand what we can do, how much we can really take from the UK model, if at all that is likely to be a hit or a miss, we're joined by Kavita Devgan, who is a nutritionist, and Dr. Ambrish Mithal, Chairman, Endocrinology and Diabetes at Max Healthcare. Thank you to the both of you for being with us. Good morning. Kavita, let's begin with you and let's start with the nutrition perspective. Do you think these kind of moves, an all-out ban till 9 p.m. on national television, can really help children pick the right choice, not get them tempted to pick that junk item that usually they get drawn to looking at these flashy advertisements?
Yeah, well, hi, good morning, everyone. Well, I honestly believe that some step is better than no step at all. Personally, that's my opinion. So there are enough studies that tell us that these advertising, because they are concocted so enticingly, they do affect the choices the children make all the time. In fact, it has taken over from the habits that are taught at home to become the number one reason why and what people and especially children eat today. So I think an advertising ban, maybe of not this sort, but some sort, will definitely help change the way children pick up foods. There is a study which tells us that when children watch a program wherein there is an advert of food, junk food particularly in it, they, even if they've had a meal, they tend to eat more after that. So it's very clearly been demonstrated that these ads definitely have an impact on the choices children make. Gone are the times when what the parents would eat or what the parents would decide what the children would want to eat. Today, the media has a huge say. So maybe not a blanket ban, but some sort of an effort, some sort of an, something which can help change the way children perceive food would definitely help, I think, from a nutrition point of view.
Okay, from medicine point of view, Dr. Mithal, how does it play out? In your understanding, for instance, low nutrition foods or low nutrition, high calorie, what do they do typically to the kind of metabolic problems that you're treating and encountering every day in your patients? So early on, if these kind of changes are introduced, can that bring about a change overall in where these children will go, let's say, 10 years from now?
Well, thank you for having me. Quite clearly, there's an impact of advertising and the use of consumption of junk food in children. Remember that when children are overweight, and recent studies in India, in Delhi, for example, when studies were done in private schools, the prevalence of obesity in children was above 20%, and that is unbelievable. And it's less than 5% when it's in government schools. So economic affluence has a huge role to play. Accessibility to food has a huge role to play. Now, these obese children they become obese adolescents, they become, obese adults. That gives rise to diabetes, that gives rise to heart disease later on in life, to fatty liver, high blood pressure. So obviously, obesity for India is a huge problem. It is not limited to adults, it's rapidly growing, and we really have to tackle it right at the beginning. In fact, even earlier than childhood, maybe when the mother is pregnant, when the lady is pregnant. But the fact is that childhood obesity in India requires urgent attention. And, bans like these will help. But as Kavita gently pointed out, actually we need multiple approaches. It cannot be just a ban that's going to do it. I'll give you an example. The availability of junk food in schools and colleges and close by. I mean, that is the biggest thing. What is available in most of our schools is still basically unhealthy food, because that is easier to cook, easier to store, deep fried, so it doesn't get infected quickly. If you have raw food which you serve like salads and veggies, etc., then there's another challenge in India, is that of getting a bug or an infection. So
and the other challenge of keeping it refrigerated.
Yes.
So if it's large quantity, then that too.
Absolutely. So that is one thing. So advertising, yes, absolutely. Not just children. Adults are also very swayed by advertising. We see that every day in the OPD. When some celebrity comes and promotes a particular item, it has a huge impact even on adults. But advertising is one component. The other is availability of healthy food as options for children and younger people. And I think that is a big question mark. So it really requires, you have to give them choices, healthy choices. Okay, don't have this, what will you have? Right? And it then flows over into the homes, where many homes don't understand. We say ghar ka khana is always the best khana, but many homes now don't necessarily understand healthy food. So everyone is having unhealthy food. Now you can't expect the child who's becoming obese to eat differently. I mean, obviously that child will also have the same. So I think multiple strategies are required. I think we cannot, this is very timely. I mean, this is a timely sort of, flag for India. There's no reason why we should be waiting for things to explode, which they already are exploding actually.
We've been taking baby steps, but I don't think they're enough, and we need to do more, a lot more. Recognize this to begin with as an urgent problem. Dr. Mithal, but tell us a little bit about the physiological changes as well in these young patients who are overweight or obese, because that really is the onset of what could then become metabolic diseases in years to come.
Absolutely. So whenever we have excess adiposity, excess fat in the body, it does many things. It clearly releases the wrong kind of chemicals in the body, right? Not chemicals, wrong kind of hormones in the body, right? Which are inflammatory, pro-inflammatory hormones. So having visceral fat, for example, fat around your belly, like around your organs in the belly, will lead to the production of bad hormones. These bad hormones will stimulate all kinds of negative processes in the body. We know that diabetes is directly linked to our visceral adiposity. We know that blood pressure, we know heart disease, all linked to what the phrase that people understand is insulin resistance. So there is some degree of insulin resistance that develops the moment we tend to put on extra fat. And when this happens in childhood, the earlier it happens, the harder it is to reverse. Because when it stays, your body gets adjusted to it. And then it becomes incredibly hard to lose that fat. So the whole metabolic epidemic that we are seeing in India is driven by excess fat, driven by obesity, right? Visceral obesity in particular. And that starts in childhood. So obviously, if we attack the root cause at this stage, we'll not only be helping our children, but we'll be overall reducing our incidence of diabetes, of heart disease, of blood pressure, and so many other benefits.
Well, there's consensus on the fact that there are several ways to go about, removing this root cause or really working on it. And both of you all have come in on that. Whether or not this is a model that India should perfect, well, time will tell. Perhaps we can pick cues from how successful this turns out to be in UK, let's say, over the next 5 years. Kavita, but is junk food the only villain? Because so much conversation is happening around portion sizes, sedentary lifestyle, lack of awareness, just one thing alone is not going to remove the problem entirely, right?
No, I agree with you. And I definitely agree with Dr. Mithal when he says that availability, we need to attack the availability. And that is where junk food and the advertising, of course, I personally feel is a huge, huge threat today. So, working on making these less available for children to start with, adults, of course, later, I think should be the first step. And it has shown results everywhere. A lot of countries have imposed bans and it's working. Norway, Chile, Mexico. Singapore has this amazing model of color, nutri-grade, color coding on the packs, front of the packs. They have a ban on the ones which are red, the foods which come in the severely junk food categories. So any model, but the point is, I don't think we should be waiting. As Dr. Mittal pointed out, there are just too many obese children. You don't even need numbers. You don't even need to look at statistics. You just need to look at, cross a bus stop in the morning where children are going to school and you see the level of obesity, which is prevalent in the country today, and it's really worsening. So waiting, I don't think is an option. Something needs to be done right away and some model will work. There was this, if you remember, there was this amazing fat tax model, which Kerala had done in 2016, but they abolished it in 2017. Yeah. So there, like you said, baby steps are being taken, but they need to be carried forward. 100%. So junk food, answering your question, is a huge, huge problem. Personally, I think it's the biggest problem today. And we need much more awareness than what is being created. The second thing is, of course, everything else, like you mentioned, lack of activity, everything. Yeah. So the 5-2-1-0 model is what I suggest every parent to focus on with their child. 5 fruits or vegetables a day, less than 2 hours of screen time, 1 hour of physical activity, 100% for every single child, and 0 tolerance to sugar and aerated beverages. So all these things also need to be done. Policy, of course, the parents also have to pitch in and they have to look at all these other aspects that you mentioned. Yeah. I agree with.
The other challenge is you're seeing junk food everywhere. So for instance, you impose this on-screen ban till 9 p.m. You stop these paid advertisements online. There are reels. There's a whole world of social media out there. There are influencers, right? So a lot of this is paid game as well. Yeah. Dr. Mithal, how do you really get to the bottom of this then? So do you have interactions with your patients, parents possibly, who come and say that, we've tried it all, we're ensuring there's home-cooked food available to our children, but there's peer pressure, there is so much exposure owing to social media, the advertisement that comes in, that we're not being able to really tackle the problem?
Yes, you're absolutely right. I mean, social media is beyond anyone's control. I think not just in food, but also in advising now, medication, everything, social media sort of takes the lead. So there is no one-line answer, as we said. It has to be a concerted effort. There has to be palatability and taste matching of healthy food. Because, the fact is that some of these so-called junk foods are very palatable. And once you get used to them, people just love them and they find it very hard to give them up. So I think, it doesn't stop at children. Younger people who are working or who are studying, they even have services for food delivery at night. They go on ordering food. Now, the food that we order, again, the healthier choices are exceedingly limited. Exceedingly limited. I mean, in the media, I have seen that. In doctors, I have seen that. Those who are working around the clock or working odd hours, they'll order in some food in all offices of Delhi. And more often, almost certainly, that will be like a unhealthy food. Obviously, we don't want to go into the details, but
how important, Dr. Mithal, is early prevention compared to proper treatment in later years?
Absolutely. In fact, if India wants to tackle, or if the world wants to tackle the non-communicable disease problem, I'm not even saying obesity, non-communicable disease problem of diabetes, stroke, heart attacks, blood pressure, even some kinds of cancer, we have to start early. There's no question. So I think addressing childhood obesity will solve many of our problems and definitely reduce the risk of all these conditions. So I have no doubt that this requires a concerted effort. A ban may not do the trick, but it'll certainly help. But 2 other points. One is that, of course, as I said, ordering in food, we need to have healthy options because it's going to continue. You can't live in a world where, we should all have home food. People who are working around the clock, who are living alone in NCR, don't have a family, they're not going to have home cooked food easily. So you need to have healthy options in ordering. Second point, which you sometimes miss, is the fact that unhealthy food or junk food is cheaper than healthier food.
Yeah.
And that is a very important point. One way that the authorities can step in and help us in preventing or reducing this pandemic is by ensuring that healthier options cost less than the burgers and the samosas you're showing and the French fries. They cost so
Kavita,
little.
in the past, we've had a conversation with her on multiple occasions. She's been of the opinion that it's okay if you have one samosa, let's say, in a few days or a week's time, but self-control, I think, is at the center of this conversation. And Dr. Mithal, thank you for telling us once again, reiterating on our show, that this is the mother of chronic diseases. And better late than never, but we must step in and do our bit. Thank you so much to the both of you for joining in this morning and taking that conversation.